So, as always, I am your host, Deanna Sizemore, and this is Tuesday Talk with Bim Group. We did not meet 2 weeks ago, which there wasn't a whole lot going on, and I didn't want to waste anyone's time. And there's still not a whole lot going on as far as regulations and legislation go, and that's a good thing considering what we've been through the past few months. However, we've had some FAQs come up, and I thought they would be beneficial to everybody. And as I was checking out the DOL site today to make sure anything new I had not missed anything new that come out, I ran across today is Cranky Coworkers Day, and I could not resist passing that along. It's that Czech holiday where they have a day for every day of the year, but it's Cranky Coworkers Day. It's a day in honor of coworkers who complain and are cranky all year long. It's a day when everyone lets them continue to complain and be cranky instead of trying to cheer them up. So if you've got a cranky coworker, let it go today. So hopefully you don't have one of those. And if you do, maybe you're working from home and don't have to deal with them. So I thought that was funny. I thought I would share. So hopping right into some of the FAQs we've been getting, it's been a lot of questions around FMLA, FFCRA leave. How do they connect? When do they apply? When do they don't apply? And what do you how do you manage that? So if we take a step back and say, who does FMLA apply to? FMLA applies to any employer with 50 or more employees within a 75-mile radius. So you could be an employer that has different locations, and maybe one of those locations is applicable to FMLA and one of those is not. So you'll just have to figure that out. No worries, Diana. Thank you. So if you are subject to FMLA, you may also be subject to FFCRA, which is the Families First CARES Act, where you are subject to pay an employee for 2 weeks of emergency paid sick leave and 10 weeks emergency paid family leave. Or 10 weeks, not 2 weeks. My apologies. So it's 10 weeks of sick leave, 2 weeks of sick leave, 10 weeks of paid leave. I'll get it right in a minute. So the question is, how does FMLA work with that? And when do you know someone's FMLA? When is it FFCRA? How do you manage that? If you are subject to FFCRA, you have under 500 employees. So even those that are not subject to FMLA, who are 2 to 50 employees or 49 employees, you're subject to FFCRA. Over 50, under 500, you're subject to both. Over 500, you're subject to FMLA. So let me say that again. Under 49 and under, FFCRA only. 50 to 500, FFCRA and FMLA. And over 500, FMLA. So the question we had was, someone had been out on FMLA due to a surgery, and they had been out 10 weeks. The person came back to work, and within a couple of weeks, the person was exposed to someone with COVID and ordered by her physician to quarantine for 2 weeks. So the question was, does this person get FFCRA? Is it FMLA? What is it? So technically speaking, it's FFCRA because it's a quarantine order by a physician, state, government, someone in charge. The person isn't sick with COVID, but they've been ordered to quarantine or isolate. So that applies. However, you have to look and see how many weeks of their FMLA they've been used. Now, this person had only used 10 weeks. She's eligible for 12 weeks based on her time served, time worked. She still has 2 weeks available. So that FFCRA 2-week quarantine that she's under is going to apply towards her FMLA total of 12 weeks. So she's eligible for FFCRA. If that person had used all of their 12 weeks of FMLA, they don't qualify for FFCRA because there's no more FMLA time left to use. So when you're looking at someone who's taking FFCRA, you also need to look and see how much time have they used on FMLA? Do they have time left? Has it already been used or not been used? And how much time do they have for FFCRA? Now, FFCRA 10 weeks paid family leave, same scenario. So it's all that time together under FMLA if you're subject to both. Another question came across was just an unpaid leave of absence. Someone not FMLA, not medical, not any COVID related situation, unpaid leave of absence. What do we do with their benefits? If you do not have a written unpaid and or paid leave policy, I suggest you get one. We can give you a couple of sample documents if that's something you want to look at, but you definitely need a paid and unpaid leave policy. Unpaid leave, if someone says, hey, I just need to take a few weeks off, I know it's going to be unpaid, what happens to my benefits? So this is where you have to think about, what does my leave policy say? What does this mean in terms of ACA eligibility? So if you're an applicable large employer, 50 or more employees, if that person is in a stability period, you have to continue to offer them coverage. They are still subject to pay their part of the premium. So they would either pay that as they went along, or they'd pay that when they came back. If they are not in a stability period, you can drop their coverage, and when they come back to work, if it's within 13 weeks, reinstate them. But it's not a COBRA qualifying event. So the question was, the person wanted to keep their benefits. Fortunately, they were in a stability period, so they were able to keep them. But had they not been, there was no reason to keep them on the benefit plan, and it was not a COBRA qualifying event because they are just choosing to not work at the moment. So anytime you run across a leave of absence, if it's not FMLA, if it's not FFCRA or short-term, long-term disability, it's just an unpaid leave of absence. You want to look at your policy. You want to look, are they in the stability period for benefits under the ACA? And confirm with your carrier how they're handling it. So this situation, the ACA piece covers the medical, but it does not cover the dental, life, disability, that sort of thing. So those are things you need to think about as well. This particular person just needed, basically it was a mental health break for a few weeks, and we were able to work it out where the ACA covered the benefits. So that's just something to think about in terms of leave policies. And not everybody has those. And that's, that's not unusual per se, but it is something that you do need. And that's more HR world than benefits world, but I wanted to be sure and bring that up. The other thing on FMLA that we're seeing is, or a question that we had, was someone was going on FMLA to take care of their parent who was in another country. They got the FMLA certification form back, and it was all in another language. And the HR person was like, what do I do with this? Well, you can require the employee to give you that FMLA certification in English or whatever you speak, wherever you may be. The employee is responsible for having that translated, just as if they were in the other country receiving healthcare themselves. A lot of the carriers require that any bills are translated into English and American dollars. So if you get an FMLA certification from another country, you can have them have that translated into English and American currency if that's on there, which it's not. I don't know why I said that. So that's the other thing on FMLA, change in status. So I was just looking at my notes here. Couple of things, COVID related, and then I'm going to talk about kind of end of the year things we should be looking for. Any questions on FMLA, FFCRA, unpaid leaves of absence? I mentioned that an unpaid leave of absence wasn't a COBRA qualifying event. A COBRA qualifying event is when you've had a loss of coverage due to death, divorce, loss of hours, but you choosing to not come to work for 3 weeks or 4 weeks or whatever been approved is not a loss of hours. If you were laid off or if your position went from full-time to part-time and you're no longer eligible, that's a COBRA qualifying event. A lot of times we get questions and I always say, what does your policy say? If you don't have a leave policy, then that's where we have to kind of go back and say, okay, here's what the regulation says. Here's how we can make it work. And hey, you need to get a policy in order. If something is a change of status or a qualifying event question, I always go to your policy. Your Section 125 plan document is going to dictate change of status. So that's going to be adding a dependent, dropping a dependent, changing a dependent information. Your plan document should reference your COBRA qualifying events. So that's going to be in there. This is why we urge you to have these written documents and policies, because they are what guide your plan. So before I jump into COVID, I just want to check one more time if anybody's got any questions on leave. And I know it's kind of a hodgepodge of questions, so to speak, but these are just some of the things that I get on a daily basis, and I thought, hey, they may benefit others as you come at it, or if you run across this in the future and you're like, I don't remember what she said, but I know we talked about it, you know, you can call me. I'm available anytime for questions and answers on leave, qualifying events, that sort of thing. So I will pull up my COVID information. So the first thing I wanted to say is OSHA is being relentless as far as penalties go. They have cited over 100 establishments with violations related to the coronavirus, resulting in penalties of $1.6 million. If you are a workplace and you've got employees actually in a workplace, not all working remote, please make sure that you are following the OSHA guidelines. And we have a link to those on Bim Group's blog page. But some of the things that OSHA found in these inspections were things that I think could easily... Yes, it is, Dina. OSHA is a 4-letter word. I think some of these things could have been easily avoided. They kind of seem like no-brainer kind of things, but I can also see in a larger corporation, maybe they get lost. But it's having a written respiratory protection program. So you want it written. You want your PPE policy in writing. Being able to provide a medical evaluation, respirator fit test, training on the proper use of equipment or PPE equipment, reporting an injury or illness or fatality, recording an injury or illness on OSHA's record-keeping forms, and just complying with the general duty clause of OSHA. It looks like most of these companies were in the Northeast, and just recently starting to head into the Midwest. I'm starting to see some Ohio, Illinois, Wisconsin. So I don't know what that means for us, but I wanted to be sure and point it out that we are seeing, of all agencies, OSHA's coming in and doing penalty assessments at this time. And it's a little bit of every kind of facility. It looks like a lot of nursing homes, rehabilitation homes, senior services, rehab services, assisted living, medical center, and then there's random management groups. So just something to keep in mind. If you are not sure what you're supposed to be doing as far as OSHA and COVID go, please go to OSHA.gov/SLTC/COVID-19 /. And again, this link's going to be on the Bim Group website. It's going to tell you everything you need to be doing. So, and again, more employment related than benefits related, but I wanted to point that out to you. Also, with that being said, there is a new requirement, which I always find some of these requirements funny, but then I have to stop and think, well, the reason it's a requirement is because someone didn't do it. And again, the things you think that are common sense no-brainers to us may not be in the moment of it happening to us. So the latest information from OSHA guidance is employers must report a work-related COVID-19 employee death to OSHA within 8 hours of learning about it. And if it's, in order to be reportable, a fatality due to COVID must occur within 30 days of an exposure to the virus at work. So I could see in circumstances if someone have a COVID-related death, were they exposed at work, trying to figure out the answer to that. But I would say just do the best you can. If an employee passes away, and all the things that you're trying to take care of in that moment, try to remember you got to notify OSHA if it was COVID-19 related. So keep that top of mind, along with everything else that you guys do on a daily basis. There is also new guidance for CDC has expanded the definition of close contact. And I think this is an ever-changing guidance, but where we are right now is as of October 21st, the CDC issued guidance expanding the definition of close contact from someone who has been within 6 feet of a COVID-19 person for 15 minutes or more to, this is what they've changed it to, someone who was within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period, starting from 2 days before illness onset, or for asymptomatic patients 2 days prior to test specimen collection until the time the patient is isolated. Individual exposures added together over a 24-hour period equal to 15 minutes. So it is a cumulative 15 minutes. I will say I think that was needed clarity on the 15 minutes, because I know of one of our employers that does a cumulative, or does a 15 minutes or more exposure, and the way they were looking at it was 15 minutes here, 15 minutes there, 15 minutes here, where it is a cumulative 15 minutes in a 24-hour period. The CDC provided other factors to consider when defining close contact for purposes of contact tracing. It's, duration of exposure, proximity. Did the person have symptoms? Were they likely to generate respiratory aerosols? Are they coughing, singing, shouting? And then the other environmental factors, ventilation, the crowd. Was it indoors? Was it outdoor? And again, CDC guidance is ever changing. That link is also on our BIM blog so that you have access to that. I'll also say that, kind of in line with OSHA, the DOL is not slowing down on audits either. So while we haven't seen, and I say we, Bim Group hasn't really seen any DOL investigations recently in our area, that doesn't mean they won't come. I did learn that the DOL does not call them audits. They call them investigations. So DOL investigations are still happening amidst COVID and everything that's going on. So it's a great reminder to make sure your plan documents are up to date, your notices are up to date, your tracking logs are up to date. Anything related to your benefits world, your 5500 filings are being done timely. That you're offering, FMLA, FFCRA like you should. It's just a great time to take a step back and say, okay, are we still doing all the things that we need to be doing in the event of a DOL investigation? One of those things under a DOL investigation is testing, non-discrimination testing on your Section 125 premium only plan or your FSA plan. Every plan year end, your Section 125, and if you offer an FSA healthcare plan, should undergo non-discrimination testing. This is something that your third-party administrator can do for you typically. Sometimes there's a fee for it, sometimes there's not. It just depends on who the carrier is and what your agreement is with them. If you are administering an FSA plan yourself, I can give you the steps to work through the test. If you only have a Section 125 premium only plan, I can actually give you the steps to walk through that as well, if that's something you would like, or we can give you, we can introduce you to a third-party strategic partner that can do that for you. If you're a self-funded health plan, you should also be going through Section 105H non-discrimination testing, and that is for your actual self-funded health plan. It's based on benefits, eligibility, compensation. Both tests, non-discrimination for Section 125 as well as 105H, are to ensure that you're not being discriminatory to your non-highly compensated employees. They are two different tests. They are done in two different ways, and both are required. So they're part of that DOL investigation checklist. So now's a good time to be thinking about it, especially if you're a calendar year plan. You're coming up near the end of the year. You want to make sure and get that scheduled. And again, if you need help with that, reach out to me. I'll be happy to assist with that. All right, the last thing I'm going to close with, and I'm gonna walk through this just to give you guys time to ask questions if you have any, because it's kind of again, it's not really substantive, but I thought it was interesting, and again, thought I would share. Just kind of an FYI, and again, feel free to ask questions, even if it's not related to anything we've talked about today. Go ahead and drop those in the chat. I'll be happy to answer them. So I was reading an article early about what benefits employees really want. And so here were some, so this article, this is the benefits they come up with, the 9 benefits employees really want. They want PTO, paid time off for volunteering. And I think that's a great thing. One of the things I love about Bim Group is we get 3 days a year off to volunteer for organizations. So in the past, I've used mine for dog rescuing. I've used it for foster care. I've used it for Carrington's Heart, which is a affiliated nonprofit that we do a lot of work with. I know other people have used it for things at their children's schools. They've used it for church events, that sort of thing. So PTO for volunteering, flexible work schedules. And I think COVID has thrown us all into flexible work schedules. True employee assistance programs. Again, a lot of our life and disability carriers offer an employee assistance program, but if you don't have one, there are third-party vendors that are available to do that. Paid sabbatical leave. I think this goes to our talking about our unpaid leave of absence. This is now going to a paid leave of absence. Hospital indemnity security. And this is to help with, this is a benefit used to help people pay for costs incurred when staying in a hospital. So it's an added level of benefit. I haven't seen a lot of these. I haven't heard of a lot of these. So I thought that was an interesting take. Mental health services. Again, most plans have mental health parity. So I was kind of confused as to why that one was on here. Telehealth, obviously, we have jumped right into telehealth with COVID. Here are the 2 big ones that we hear a lot about. And I'm not saying they're good, bad, or indifferent. This is completely non-partial, is pet insurance and student loan repayment benefits. So we're starting to have a lot of questions about student loan repayment plans and that benefit and how that works. So if your renewal's coming up anytime soon, maybe those are things you want to talk about, or maybe it's something you want to address at a mid-year meeting to get your arms around before you're in the throes of a renewal decision. So I just thought I would share that. Any questions in closing? Oh, one last thing. Election is coming up. If you haven't already voted, or you haven't voted via absentee ballot, state of Kentucky does require up to 4 hours of leave, unpaid, for voting. So make sure that you are offering that to your employees. The rule is, unless an employee has at least 4 consecutive non-working hours to vote during poll hours, the employee is entitled to up to 4 hours of unpaid voting leave. No proof of voting is required, but an employee who takes time off and does not vote may be subject to disciplinary action. How you know that, I don't know, but that's out there. So just remember to give your employees time to vote. And if you haven't voted, may I strongly encourage early voting. My husband and I went on like a Wednesday afternoon, like 3 o'clock. We walked straight in, voted, and left. Here in Fayette County, I think it's at most of the libraries. But that is my spiel for voting. So I will close with that. If anybody's got any questions, you think of them after the fact, feel free to email me. I'm Deanna, Deanna at bimgroup.us. And if you think of something you want to learn more about or know about and want me to talk about on Tuesday Talk sessions, feel free to shoot me a message about that as well. Be happy to address those questions. And I appreciate you all, as always, joining me today. And have a great rest of the week. And we'll touch base in a couple weeks. Thank you.